and I am the Vice President of Operations for Crisis Services with Monarch. BHUC is the Behavioral Health Urgent Care, and one of the things that makes it unique from other mental health facilities is that we are part of the crisis continuum of services. And so we work with folks when they are at their lowest as far as a crisis, and we really work with them to help get them back to baseline so they can go back out into the community and be successful. So young adulthood is probably one of the hardest times in life when we're really kind of learning about ourselves. It's also one of the times where, as far as mental health diagnoses, the symptoms really start to kind of come out. When you walk into the BHUC, you will initially do your registration process, which includes a bunch of assessments about how you're doing and what your needs are currently. And then from there, you'll head into nursing, and nursing will clear you medically for the whole process. And then from there, they'll meet with a qualified professional to go over social determinants of health, just to make sure that if there's any community needs that they have that are possibly contributing to what brought them in, that we are able to refer out for those services as well. And then they'll meet with a therapist for the evaluation, and that goes over, what brought them in. If it's anxiety, we'll talk about their history with anxiety, things of that nature, and then they'll meet with the prescriber for any medication needs. So if you have a student who is in crisis, an emotional crisis, it could be stress-related crisis, it could be depression, anxiety, it could even be psychosis, or maybe they're even at risk of being off their medications, and so they're at risk of a crisis. Any of those individuals are appropriate for the urgent care setting, and so referring them to this setting versus referring them to an emergency department, where they may have to wait for 6-8 hours to be seen, and then they may still not get their needs met. We're a specialized service that can meet those specific mental health and behavioral health needs. So after someone is leaving here for their urgent services, we will connect them to outpatient services. So that could be another Monarch facility, it could be another outpatient facility in their area, but we'll connect them and link them to outpatient services for continued care. We also can link towards higher levels of care if there's residential needed, or anything higher like hospitalization. We do those referrals as well, but we do refer out to whatever their needs are for ongoing care.